So, fat grafting. Let's take a beach walk and talk about it. It's a great topic, lots to unpack in terms of the good, the bad, the ugly. So, what is fat grafting? Fat grafting is taking your own fat from a different part of your body. Usually in my case, it's the lower abdomen or lateral thigh, but there's other options. Taking some of your own fat, specially processing it, and then using teeny tiny little cannulas to transplant it essentially into specific areas and planes of the face to provide natural and permanent improvement in volume. The good of fat is that it can give really nice, natural looking improvements in facial volume for people who have had either significant weight loss or age-related fat wasting. So fat is your body's own tissue, so you're unlikely to mount an immune response to it, and generally it has fairly good overall survival. The literature usually comes in around 70% of the fat that's grafted lives. When we transplant fat, we're not only transplanting the little fat cells, there's also a lot of good growth factors and stem cells that come with the fat. And so that actually leads to a regenerative component that when we're grafting fat, you also sometimes get an improvement in the overall tissue quality and skin in the area that fat was grafted to, kind of as a bonus. What are the drawbacks of fat grafting? So the biggest drawback is probably that it can sometimes be unreliable, meaning we like to say 70% of it lives on average. Sometimes it can be more, sometimes it can be less, depending on a person's own body, depending on how the fat was handled and processed, how it was put in. So it's important to go to somebody who's experienced in fat grafting. It also can depend on other things. Patients who smoke, I don't offer fat grafting to because it will not get a blood supply and live. Similarly, patients in the GLP-1 agonists like Wegovy or Ozempic also I feel like have a lower rate of survival with the fat grafting. So people need to be off of those medications before I recommend it. The other kind of drawback, people are afraid of fat grafting because it can be overdone. Generally, when I'm grafting fat, we're talking for a full face fat grafting, it'll be on the order of 20 to 30 cc's. And there was a time in facial plastics when the norm was much, much higher. People are grafting 80 and 90 cc's of fat and just having these perfectly smooth, beautiful, supple faces that when it all came down to it kind of ended up looking a little bit unnatural. They were too good. They were not believable. And so I think the pendulum's swinging the other way. Certainly in my own practice, fat grafting is a tool, but it's not something that should be overdone. Fat grafting can be done at the same time as another procedure. It can also be done on its own. One of the things that affects how the fat lives is trauma to the surrounding environment, and if there's a lot of blood in the area, the fat will have a lower rate of survival. So fat grafting with a facelift can be a powerful tool, but in some cases it may be better to do the fat grafting as a planned adjuvant procedure, 6 to 12 months after having another major surgery, just to allow you to have a better survival and also know how the healing has settled so you can kind of correct for any underlying asymmetries or irregularities that somebody might have. Fat grafting is something that's extremely surgeon dependent. So you have to do a lot of it to get good at it, and you have to be very careful how you process the fat. I harvest all the fat I use for fat grafting by hand, meaning I am not using machine liposuction that's going to beat up the fat cells and cause them to lyse. I'm extremely careful in how I process them. I do not centrifuge my fat. It's all done by hand, which I think is important to improve survival. And then it is grafted nearly immediately after harvesting and processing, and that allows you to get that fat in and give it the best chance of actually surviving in its new environment. So there's a lot of facets to fat grafting. It's a great adjuvant tool, and in the right hands, I think it's a key step to getting an excellent result. So thanks again for coming with me on this beach walk, and any questions you have, please leave them below. Anything else you'd like me to talk about on one of these beach walks, please leave them below. Thanks, and I hope you have a good day.